Next, I'm going to introduce our speaker today, who is Dr. Jonathan Beever. Dr. Beever is an environmental philosopher who is focused on questions of ethics in science. He is professor of ethics at the University of Central Florida and is the director of the UCF Theoretical and Applied Ethics Graduate Certificate Program. His research seeks to understand and impact the ways in which we all relate to and value ecological relationships at the intersections of digital and analog environments. His work as a whole seeks to understand and impact that ways we relate and value to the rest of the natural world. Today, Dr. Beever will lead a discussion to identify some tensions situated with COVID-19 and situate those ethical issues in a problem that continues to bother him. What does it mean to relate to one another? Thank you, Dr. Beever.
Thank you, Charlotte, and thank you everybody for inviting me, especially to Martha and Janet for the initial invitation. I'm so grateful to be here this morning with you all. The other hat that I wear that hasn't made it into my bio yet, because it's relatively new, is that I am the founding director of the UCF Center for Ethics. So the Center for Ethics exists at the university to help us have discussions like this. So again, I'm really grateful to do this work with you all outside of campus as well. My focus, as Charlotte mentioned, my focus this morning, I just wanted to tell you, it's basically, there's nothing going to be it's not going to be particularly heady or philosophical. I'm going to try to keep it grounded in my experience, but I'm really fundamentally interested in this question Charlotte mentioned: how do we relate to one another? So I want to tell you 3 pandemic-related stories and just have a conversation with you. And you should feel free, anybody, to interrupt me at any time, either by chat or by unmuting yourself and sharing your views. But the first story that I was thinking about early this morning was had to do with masks and my neighbors. It feels to me like many of my neighbors have given up on this idea that we should be wearing masks in public. Maybe they don't wear masks when they're around me or other neighbors, or maybe they don't wear masks when they're around their family, or they just leave them in the truck when they go to the store or something. And many of those same people, when in conversations with me, they'll say things that make me worry. Like they'll say things like, oh, I read that hydroxychloroquine is safe and it's being suppressed, right? Or they'll say like, I just don't trust the information we're getting about testing results or something, right? And yet, on the other hand, these same people are wonderfully kind and giving, and it's made me wonder over and over again what's going on there. And as an ethicist, the thing that I orient around is that they and I share different values when it comes to this very specific issue of mask wearing. And I want to talk a little bit about what I think is going on there, but I wondered if that story resonated with anybody here in this group. I hope it's not just me, but it seems like we're all surrounded by very distinct opinions about pandemic-related issues like mask wearing. Does that sound familiar to anybody? Charlotte's nodding, Martha's nodding. Yeah, here, let me expand a little bit so I can see the chat a little bit better. Yes, I'm glad it resonates, and it's not just me. That makes me feel a little bit better. Yeah, yes, yes, Renee is mentioning that, yes, even family members can be very kind and loving, but hold very different views. And we're noticing this, I will share with you that I'm noticing this with our own families too. My wife and I both, our parents have very different views about how to handle the pandemic on 2 different ends of the spectrum even. And we feel like we're in the middle and we're feeling a little bit crazy. So there's this sort of self-doubt that sneaks in too. So as I got thinking more as a philosopher now about what that means to me, it seems like there's a couple of things going on that we need to focus more on. One of those are what I would call epistemic problems, like questions about what we know and how we know it. So for instance, when somebody says hydroxychloroquine is being suppressed, right, and it could be valuable. When you read the FDA report, the recent report in June that came out that rolls back its former stance on hydroxychloroquine and says we shouldn't be using it at all, that's based on harms done by testing, right? Large-scale studies. But when you read that report, it's targeted towards scientists. So I won't share this with you, but you can look it up on your own. I can send the link I'll put the link in the chat window if I can manage that now. But this, this report is targeted towards, there, it's in the chat window now. This report is targeted towards scientists, and so you really have to have a pretty strong sense of very specific terminology to make very much sense of it. So, you know, there are some things that if you watch Grey's Anatomy, you'll know, like tachycardia, right? You've got that sense, and brachycardia. QT, prolongation, VA, VF, and VT. There's TDP problems and AV block problems, and all of these are reports about physical harms that have been done to patients through the use of this drug, right? But if you weren't familiar with the technical knowledge that goes into medical decision-making, it would be hard to, from this data, to pull out the knowledge that we shouldn't be using this drug, or to pull out the reasons why we shouldn't be using this drug. And those questions of knowledge or epistemic issues are coupled with ethical issues too. So like, you could imagine your neighbors, and I imagine this about my own neighbors too, whether it's true or not, is that they're really valuing liberty, right? This freedom from obstacles. Like, I don't want to wear a mask because it's a block of my freedom, right? They're putting that up, they're prioritizing that against some version of like a care principle. Like, we ought to be caring for our families or our neighbors, and one reason to wear a mask is not really to protect myself, but it's protect you. And this idea that mask wearing, I find myself valuing care over this idea of liberty. We could play this game for a long time thinking about the ethical issues that are at work here, but I think this idea that there are conflicting values that reshape how we're relating to one another, especially under conditions of stress, is key to what I wanted to share with you this morning. And then I think there's another thing that's going on here, and as we're now 7 months into this pandemic, and that is, I think, just engagement fatigue. I've had friends and neighbors and even family say to me, like, you know, I was following guidance, but it's just so overwhelming, and it just seems like it's going to go on forever, and there's nothing I can do. And so the longer a problem draws on, or the further on the horizons its impacts appear, the less likely we are to directly engage. And as Charlotte mentioned, I spend a lot of my time thinking about environmental philosophy, and the same thing comes up in issues of climate change. These are long-term, longitudinal problems we're facing, and their impacts are rolling out on a very quick geological time frame, but in a very short human time frame. Other way around. Yeah, other way around. And that really matters, right? I think we're suffering from this sort of engagement fatigue there too. So I find myself questioning myself. I think that I've got a pretty strong sense of this idea that I'm wearing masks to protect my neighbors and my family, and then therefore myself, my community, right? I'm wearing masks to protect my community. But what's going on here is that these values are conflicting with other people's values. And I find myself questioning, how do I evaluate the rightness of my own decisions while still being neighborly? Now, I'm in my little example I gave you, I'm talking about a very specific case with actual physical neighbors, but I think this idea about valuing rightness as opposed to neighborliness is something that we're facing in every sphere of our interactions with other people today. So that was case one. Case two, this past Friday, Governor DeSantis rolled out a sort of surprise phase 3 reopening plan. And I'm sure poor Charlotte's shaking her head, but whatever you think of that plan, the details are, right, there's right now, according to Governor DeSantis, restaurants and bars can have to operate at a minimum of 50% capacity. There's no state mandates on capacity to restaurants and bars. There's a suspension of any fines that used to exist for not wearing a mask or social distancing. And I learned about this because my county late last night sent out a message on our little community website reminding citizens that Seminole County, where I live, has a mask mandate, but it's still voluntary but highly recommended, right? And they did that just to say sort of quietly that we're in compliance with the new state mandate, but we still think you should be wearing masks. And this is coupled to the idea that the data coming from experts that we're going to see a resurgence of cases in the fall and the winter as people go back indoors, as schools go back in session, as restaurants open up. And this strikes me as really important to think through. We faced 14,000 deaths in Florida over the last 6 to 7 months from COVID-19. And just to give that some context, and I'm sure you've all done this work as well, but there were reported 3,091 deaths from influenza over the entirety of 2018. So we've seen an order of magnitude difference in what's happening right now in COVID. And yet, like, the same problem, I think, exists at the level of Governor DeSantis and the state as it does with my neighbor and myself. It's this idea that there are value conflicts that every one of us has to think through. And this has become very public with Governor DeSantis because his focus, as it needs to be as governor of the state, especially Florida, is on economic recovery. And he thinks COVID shut down the entire state, cost everybody a lot of money and jobs, and that has to weigh somehow against this concern about public health. Now, if you want to put that value conflict I just gave you in different terms, you could lay it out in terms of jobs versus lives, right? The idea is, I'm sure Governor DeSantis realizes that there will be a resurgence of cases. He's admitted as much. More people will die from COVID because of his reopening. And yet that value, people's lives, is a few people's lives, is weighed out in this sort of very utilitarian way against the hope that the economy in Florida will recover when we reopen. And again, there's a value conflict. And I think these decisions where many of us hear this news and you know, shake our head in consternation or celebrate, whichever end of that spectrum folks may lie on, the job I think that we all have nowadays is to focus on these points of conflict. Why are the decisions being made? What are the values being weighed against one another? And trying to see things from that other perspective. Okay, so I gave you a personal story. I gave you a state story. I want to give you one more personal story. This story is about a family member and I on social media. So a few weeks ago, I posted some numbers like the ones I just gave you about deaths from COVID versus deaths from influenza, trying to, and all I did was pull this from CDC data, like publicly available, scientifically verified data. And just to make this the quiet point that this matters, right? We should be focused on COVID-19. And very quickly, I got into a discussion, which I am loath to do, but a discussion on social media about dying of the virus versus dying with the virus, and we can talk about that distinction, about undercounting deaths versus overcounting deaths against, like, you know, what the CDC has called a spike in excess mortality. And this all circled around, you can't trust the government, there's a conspiracy going on, like the numbers don't mean anything, you're being used, you know, that sort of thing that we hear all the time in the news and on social media. And normally I find myself just thinking, well, that's just an epistemic problem. Like the people who hold views like that just don't have the same information that I do. And so I can sort of ignore those conversations. But in this case, this was a member of my family, like somebody I grew up with, right? This is somebody who I'm related to by blood, as they say. And it really struck me that we came from the same place. And although we don't have the same experiences now in our adulthoods, I wondered where that difference was coming from. And nothing this person said was empirically wrong on its face. For instance, like there is some complication around how you measure what someone dies of, for instance. Like how do you measure this distinction between dying of the virus and dying with the virus? Like how do you weigh out existing complications and, right, if you've got cardiac problems and have COVID-19 and you pass away, like how is that related? So there are some complications with reporting. So again, nothing empirically wrong on its face, but what I came to realize was the data was being interpreted from a very different value perspective than my own, right? I found myself, my instinct is to think, I trust science and I trust data. I understand how science works, or I think I do. I want to be respectful of other people's health and values. And so, like, again, I wear a mask and I worry about the numbers. And I think my family member held a very different set of values where he focused on autonomy, his right to act alone, right to decide how to act, his sort of intuitive distrust of bodies who he sees as suppressing that right, governmental bodies, political bodies, scientific bodies in this case. And so we had this discussion, and I tried my best, as I'm trained to do and as I'm wired to do, I think, to have a really respectful conversation. But then I watched as my social media page exploded with vitriol and heated words and sarcastic replies and some downright vicious personal attacks. And I thought, what is going on? The values that drive us are always there, right? Every time we have a disagreement with somebody, we can do that from a place of respect. We can do that from a place of education, or we can do that from a place of what seemed to me to be hatred. And this really struck me as a very powerful moment for me. I saw the same value conflicts I've been talking with you about for the last few minutes, right? I saw questions of trust versus access versus privilege, and I'll say more about that in just a second. I saw conflicts between privacy, my privacy, my information, or my rights versus public health, which is much more open. I saw epistemic questions versus ethical questions. But none of that explained to me the vitriol, right? That explained to me why my family member and I had a disagreement. And it gave me space to think about ways in which I could develop arguments to support my case or to offer counter evidence to this person's case. And that's the way this should work, I think, as a philosopher, naively. But the thing that I wasn't counting on, and that wasn't in my equation, my mental calculus about how this would work, was stress. And I think this can't be oversimplified. So the history of philosophy has suggested that you and I are, everybody, all human beings are defined by our capacity to reason. So we can think through a problem, come up with reasons, justify our positions on things and produce an action. And that's how that works. But contemporary moral psychology has suggested that we don't do that often and we don't do that very well. Even though we're wired to be able to make rational decisions, our capacity to act rationally is limited by external constraints. Those constraints are everything from, being overwhelmed to feeling stress to being manipulated by other people's actions and attitudes. But fundamentally, what I think is going on in the pandemic, and maybe not just the pandemic, but also social and political conditions right now, is that we're all under a tremendous amount of stress. And that stress produces an inability to act rationally or to think empathetically, for instance. And that made me wonder, why am I not feeling this same push to be sarcastic or to be hateful on social media? And the answer, I think, is, partly perhaps it's how I'm wired to be passive rather than aggressive. But I think partly it's also a question of privilege. And as a middle-aged white guy, I struggle with this regularly, but I come from a place of privilege, right? I don't feel the same stressors. I'm supported in thinking the way I think by my institution, by UCF, by my colleagues, by my training, by my credentials. And I think this puts me in a position of privilege. I don't have to feel like I'm under attack. I can feel instead, I'm trained or habituated to feel like I'm supported, not under attack. But that's not true of the majority of Americans, I would say. I think most of us in this meeting right now, and I think most of your congregation members are also in that same position of privilege. And I think recognizing that is really empowering. Not that we need more empowered, but it also helps us be more empathetic, because I think it helps us explain why there's rioting and looting in the streets, right? Where that comes from, why there's political and social discord right now, and how you can engage that well. Now, you note I stepped away from my third and last story to soapbox for a minute, and I apologize for that. But you can tell I feel very passionately about this idea that our decision-making is impacted by our stress conditions, and it's made me really quite introspective. What do I do with my privilege? What do I do with the fact that I feel like I can sit back and think still pretty rationally about what's going on? I don't have any answers to that, but I wondered if my story, again, related to your own experiences, if you've thought about these moments of tension with friends or family members or community members, have you thought about them in terms of value conflicts? And just to turn to the chat, because, oh yes, please, Roy.
Well, I don't know if you called on me or not, Jonathan.
I did, yes, please.
Okay, good. I think there's another factor as well. I'm 79 years old, obviously a target and vulnerable. So I actually get very angry when I see someone in a public place, a grocery store, for example, not wearing a mask. And especially, I've had a couple of occasions where I had to do business with someone, and they weren't wearing a mask. And I said, well, I pretty much said, put your mask on or we won't be doing any business. So I actually walked out of a restaurant one time because even the waitress wasn't wearing a mask who came to the table. So there's this distinction between also between younger people who think, oh, if I get the virus, maybe I'll get a headache. If I get the virus, statistically, I'll die. So, and my wife, who has underlying conditions. So there's an age distinction here as well. That's all.
That's really helpful, Roy. Yes, and again, this comes from drawing on our perspectives. And that's why these conversations, I think, are so important. The age-related emphasis is key. It's not just age-related, of course, but as Roy mentioned, it's underlying conditions. And again, to kind of circle back around to something I said before, there's some epistemic problems here too, right? We're still learning about this particular virus and trying to figure out whether that's genetically or physiologically, what underlying conditions relate to what outcomes. So there are certainly cases of virile young men like Roy who are coming out of COVID-19 positive cases just fine. And there are others who don't, right? Who die, as Roy said. And I think that risk, that unknown is really powerful. And again, that unknown is a point of stress. So I think it's a completely reasonable response, and that may sound counterintuitive given what I just said, to feel angry when somebody around you is not wearing a mask. I mean, I think, but recognizing from where, as Roy has, recognizing from where that anger comes is really powerful. And again, I think this is part of the building of empathy or perspective taking that's so important to ethical decision making. There are lots of things going on in the chat here, so I don't want to lose those. But Charlotte said, yeah, the conflicts with family values are also among the hardest for her to rectify, and I think that makes good sense, right? If you're thinking that, and this is where I want to move in just a minute or two, but thinking about how we relate to one another, our family relations tend to be, for many of us, the tightest relations we have, and when there's conflict within those, that's you can't get distance from that, emotional, psychological distance from that as you can from neighbors or from the state or from social media. And so that is really difficult. And Laura said, it's a shame that respectful debates devolve into vitriol, and it shouldn't happen, right? It creates an even more huge divide. And I think she's exactly right, but I would just add on that, again, I think the reason that happens is because of this feeling of vulnerability. And vulnerability has nothing to do with how strong you are, right? Or what is some other sense of self. It has to do with sort of your intuitions about your position in a network of power. That sounded overly academic, but I think we all get the point. Yes, sarcasm, and Paula added, sarcasm is the weapon of the powerless, and I think that makes sense. And I would argue is anger, and anger's not right. So are rage and violence and hatred, right? I think it's not, and again, to say that those are weapons of the powerless is to put them up as weapons of the weak, and that's not the same thing as the powerless, right? And again, now I'm talking out of school, but I think this is a really important point to think about the way that our privilege impacts the ways we can respond to situations. Sylvia says her instinct is to shut down and not respond. Yeah, and I think that's a lot of our instinct. And I would say, if you look at the way that, at least in the news, liberals have been set up against conservatives, the idea is that conservatives tend to be loud and outgoing and sometimes vitriolic, and liberals tend to be quiet and not engaged. And I think that might be because, you just You don't want to, you just tend to shut down and not respond out of conditions of stress. And again, I think that's because of privilege, and we could talk a lot more about that too. There's a lot to say here, and oh, I'm so sorry. And I just saw Charlotte mention, Evelyn, you've had your hand raised. Do you want to join in?
Yes, I recently had a conversation with somebody who was very claiming their independence. And of course, you know, as a Unitarian, our seventh principle is the interdependence. And so I pointed out to this person, well, perhaps if you feel that strongly that you are not part of the community, then try going to the mountaintop. Try growing your own food. Try dealing only by yourself with your medical issues, etc. If you don't feel you're part of the community, then live in that state and see how long it'll last.
Yeah, thank you, Evelyn. That's a really good transition for what I wanted to say next. And you know, it's interesting the way you laid that argument out too, because I've heard the same thing from say family members. In fact, this particular family member I'm thinking of has said to people, if you don't like it, just leave, right? If you don't like how America is, just leave. If you don't like how the community is, just leave. And in some ways, yeah, I get it. The other thing you might think is, no, stay and fight. Like the idea of the community is that we're bringing our perspectives to bear, and those perspectives should be discussed and taken into account and shape what the community is. That's really powerful, Evelyn, and I like the distinction you made between independence and interdependence, and that's where I want to go in just a couple of short minutes, because this is a little bit more of a philosophical point. I've been thinking a lot about this over the last few years, like what does it mean to relate to one another? And I think there's at least three views of this. There's a view of independence, as Evelyn was pointing out in her story, right? This idea that we exist as our own, like, rationally capable, autonomous agents in the world, and my decisions come from me, and they come from within, and I can go live on the mountaintop and be self-sufficient, right? There's a lot of like Western Enlightenment leftovers in here. Like maybe we can blame Rene Descartes, maybe, or Spinoza if you like him better. You can blame some old dead white guy for this idea that we're independent and rational agents. That idea, I think, has left us pretty well. I think in the 19th and 20th centuries, we've come around to this idea that we are instead interconnected. Now, I want to be careful here because I'm going to give you three different terms: independent and interconnected with the first two. So on a view of interconnection, we still have the sense of individuality, right? That Evelyn and I are distinct from one another. We're like billiard balls, and we interact in situations like this. And so our forces send us off in different directions, to extend the physical metaphor. We're still snowflakes, right? But we affect each other. And I think you get this in some of the early ethics of care literature and from social and feminist thinkers, the idea that, that how we work in the world impacts how other people work in the world. Does that make sense? So it's a world of connected individuals is the view of interconnection. Now, I think for most of us, when we think about how we work in the world, that's probably where we lie. But Evelyn mentioned that part of the community here is focused on interdependence. And at least on my read, that is a radically divergent view. I'm not morally evaluating here, because I think actually it's the right view. But the idea that interconnection means that we are, that I am contingent on my relations. So to say it in other words, I wouldn't be me if it weren't for my network of relations. Now, I mean relations in the biggest sense possible, right? I mean my network with you all, my network with my university and my family. I mean my environmental networks, like my relationships to the world in which I live. I mean my microbial relationships, like the gut microbes who make up who I am, without which I couldn't survive, right? The biology of me is a network of relationships. And there's nothing about me apart from those relationships. Now that's a pretty strong sense of interdependence, and I think it has some really weird implications for thinking about questions of the self and the self over time. Like, how am I Jonathan Beever over time if my relationships constantly shift? And if you bite the bullet, as philosophers say, on interdependence, I think the answer is I'm really not the same person over time. Who I was as a say teenager, right, is not the same Jonathan Beever as I am right now. And who I will be at 79, if I make it that far to join Roy, like, I'm not going to be the same me I am now, right? And that's not just tongue in cheek. It's not just like I'm going to know new stuff. It's that I'm fundamentally going to be a different person. Now, again, that's a pretty strong view of interdependence. But I like it. And I got thinking about it because of this book that actually was written by a graduate student in biology. Kriti Sharma was her name. I think she was at NC State or Chapel Hill or one of the North Carolina schools. She wrote this really beautiful book as a biologist on interdependence, where she described interdependence as a thoroughly contingent existence. And I like this. I like this idea that I am thoroughly contingent, right? That it wouldn't take much. If Evelyn sends me to a mountaintop to be by myself and grow my own food, I am going to die. Like, it's pretty clear. I hope you don't do that, Evelyn. That would make me sad. But but you get the point, right? Like, my relations make me who I am. They make me able to be me in a physical sense, in a survivalist sense, in an intellectual sense, in an emotional sense, in a biological sense, in all of the senses. My relations make me who I am. And this, I think, circles back, Charlotte, to the quote that you gave us to start from Cyr. Like, it's not a question of who am I, it's a question of whose am I? Like, whose relationships make me who I am? Like, and who owns those and who controls those? And again, now we can circle back to this question of power and privilege. Like, how much in control are you, or do you feel, of your relations? And I think that goes a long way in describing the sort of conflicts we face here in the pandemic. I know I'm at the end of my 30 minutes, so I want to just say two things. I did a book project trying to think about the implications of interdependence. I'm going to put its little cover in the chat window here. It's a book on film and philosophy and interdependence, looking at why interdependence might be kind of scary. So I'm looking at it through horror films or science fiction films specifically. So you can, the other thing I wanted to say is that the Center for Ethics at the University, UCF, I run a network of ethics interested individuals from the community and from the university. And every 2 weeks we hold something called the Be Better Club. And it's a chance for our students and faculty and staff and community members to get together with me and my co-director, Steve Kugler, who's from chemistry and optics at the university, to think about ethics. So we think about the pandemic, we think about COVID, we think about, you know, health and justice questions. It's pretty wide ranging, but everybody brings their own ethics interests to the table. And again, it's to get at this idea that we can know each other better and relate better by understanding the values we bring to the table. So if you're interested, I would welcome you to anybody here to join our Be Better Club. You can find more information about that by reaching out to me directly. I wanted to thank you again, everybody, for including me in the conversation this morning. And I hope you do well, be better, and stay safe.
Wonderful. Thank you so much, Dr. Beever. And we just want to invite you to stay a little bit behind if you're available to chat after the service. Thank you so much for a fascinating discussion, very topical, and got a lot of us thinking for sure.